Hello everyone, welcome to this channel. In my last video, I talked about our female reproductive organ, ovary. If you want to see that video, then click on the button and watch the video now. Today I'm going to talk about our next female reproductive organ, which is fallopian tube. As you can see in this photo, it is also known as uterine tube. Okay. Now about this, you have to know a few things. That this tube has two end or two part, medial part and lateral part. Medial part is connected with the uterine wall or the wall of the uterus, okay, and the lateral part presents towards the ovary, okay. Now second point, this tube is situated in the broad ligament, the free margin of the broad ligament, okay. Now number 3, the length of the fallopian tube or the uterine tube is almost 10 centimeter in both sides, right side, left side, okay. As you can see in this photo, we divide our fallopian tube again into 4 subdivisions. So first of all, fourth one or the lateral one, it looks like funnel shaped. That's why we call it infundibulum. Okay. Now the end point of the infundibulum gives multiple finger-like projection. We call these Fimbriea. Now one of these Fimbriea is long enough to connect with the upper pole of the ovary, okay, or the lateral pole of the ovary, as I said in my last video, okay. Now this Fimbriea is a part of the tube, the fallopian tube. So we call it the upper pole of the ovary, is also known as tubal pole of the ovary, okay. Now here's the thing, this infundibulum is almost 2 to 3 centimeter in length, okay, and the next part of the infundibulum is known as ampulla, okay. Now this ampulla is almost 6 to 7 centimeter long and the diameter is almost 4 millimeter, and this is the most common site of fertilization, where the sperm meets the oocyte or the ovum in this point, okay. Now I will talk about this mechanism later, not now. Now the second part or the after part of the ampulla is known as isthmus. Now this isthmus is almost 2 to 3 centimeter and the diameter is same 4 to 5 millimeter, okay, and the part which connects with the wall of the uterus or the uterine wall is known as intramural part or uterine part or interstitial part, okay. Now the length of this part is almost 1 centimeter and the diameter is almost 1 millimeter, okay. That's it. Now here is the one extra additional knowledge point is, see, as I said, this fallopian tube or uterine tube presents in the free margin of the broad ligament of uterus, okay. Now suppose this is the broad ligament, okay. The sleeve of my jeans shirt is broad ligament and inside there is my hand is imagine this hand is fallopian tube, okay. Now in ovary, I said that posterior border of the ovary is double folded peritoneum, which is converted as mesosalpinx and connects with the broad ligament, okay. Now the portion or the area in between this mesosalpinx and this fallopian tube, this portion is known as Mesosalpinx, okay. So the Mesosalpinx is the area of the broad ligament in between fallopian tube and the mesosalpinx of the ovary. That's it. Blood supply, you will get few branches from the uterine artery and few branches from the ovarian artery, as well as the venous drainage. You will get the pampiniform plexus from the ovary and also few vein from the uterus, okay. And in the nerve supply, it has sympathetic and parasympathetic component. Sympathetic comes from the T10, T11, T12, L1, L2, okay. So T10 to L2 gone, and in the parasympathetic same to same, S2, S3, S4 gone. In microanatomy, at the cut section of the fallopian tube, you will get 3 layers. Outer layer is known as serous layer, which is mainly the peritoneal part, okay. And the second layer is our muscularis mucosa, and the third part is our mucosal layer, okay. It's the innermost layer, consists of 2 types of cell. One is ciliated columnar epithelium, another is non-ciliated secretory cells. Now this kind of cell is also known as PEG cells. Now, I will talk about this PEG cell later, not now. And as per the function, you already know that the function of the fallopian tube or uterine tube, it's a duct or it's a passage, okay. It conveys the oocyte or the ovum to the uterus, and after fertilization, the mature zygote, it conveys towards the uterus. That's it, nothing else. So this is all about fallopian tube. If you understand, then like it, subscribe it, share it. Till then, bye.